And as mentioned, we welcome Dr. Tim McKnight into the studio. How are you this morning? I always have to check on you.
I'm doing great.
Somebody has to check on the doctor, right?
Yeah, that hardly ever happens, so I appreciate it.
No problem. Today I want to talk about something that sounds very serious, atrial fibrillation. Anything to do with your heart is pretty serious, though, right?
It's serious, can be serious, and it's extremely common.
Okay.
Since 2005, we have doubled the number of people in the United States and Canada who have this condition. So it's about 2 to 3% of the population. It's actually very common.
Are we detecting it more, you think?
No, I think it's
people are just having it more.
I think it's just the combination of our lifestyles. We've talked before about how obesity rates are going up, and there's a lot of people with sleep apnea that's undetected because of obesity and other issues. So just a number of risk factors that many of us have or develop over time that put us at risk for this, and often we don't know we have it, and it can be life-threatening.
Are there other names for it?
No, that's atrial fibrillation. That's it. It's a heart rhythm problem, and if you don't treat it, it can lead to a stroke. And you also see heart attacks with it. Heart disease actually puts you at risk for it. So it's pretty common, like I said. And if you imagine the heart is it's a four-chambered muscle, and the left half of the heart pumps blood to the body. And so the left ventricle pumps blood to your entire body. The right ventricle pumps it to your lungs. Well, there's a little chamber on top of the left ventricle that pushes the blood into the left ventricle so it can go to the body, and that's the left atrium. I try to explain it as, just think of the heart as a muscle with a wiring system, a conduction system. It's not a physical wire, it's a chemical wire. Mm-hmm. And anything that stretches or changes the structure or the size of that muscle or those chambers can cause a short-circuiting. And that's what atrial fibrillation is. It's a short-circuiting. So instead of that left atrium pumping blood with one strong stroke into the left ventricle, it starts to almost shake at times and not really give us a good strong push of the blood, so it can fibrillate, and that fibrillation is like a shaking. And instead of emptying the entire chamber out with blood, which is about 2 to 3 ounces, it shimmers a little bit, and if that happens too long, then the blood doesn't move inside that chamber and starts to clot. And then you finally squeeze that ventricle, and that will squeeze into the left ventricle and then cause the stroke to occur. So we see this in people, again, with emphysema, with heart valve problems that they don't know they have, a murmur that's not been detected. We see it in people who have sleep apnea. We see it in people who have heart disease. So often, if you go to the cardiologist with atrial fibrillation, they want to do a stress test to make sure you don't have a blockage someplace. So those are some of the predisposing conditions. And the symptoms are often just shortness of breath, lightheadedness, dizziness, or feeling a sense that your heart's beating too fast or irregular, a palpitation. And that really, you can't blow that off. You really need to have that checked out. Sometimes we can hear the abnormal beats when we listen with our stethoscope, and sometimes it sounds so close to a regular rhythm that you can't detect it, so you need an EKG to determine if it's really irregular.
So you can look at it.
Yes. And really the biggest danger with it is when the heart rate goes up above 100 beats per minute. And those people often, if it's 140 beats a minute, they're often in the emergency room. They feel lightheaded. Something doesn't feel right. They feel like their heart is racing, and they don't realize they have atrial fibrillation. So we can give them medication intravenously in the emergency room to slow that down. But often we can't correct that abnormal rhythm without further intervention. And the key is preventing the clotting situation from happening. So a lot of times, almost always, we're going to put you on some kind of a blood thinner until we can determine, is this reversible or are you stuck with this?
Right. And so, again, we talked about blood thinners, I think, before with the clotting. Mm-hmm. Good for some things, but you can't stay on that forever either.
No, and if you're an elderly person at risk for falling, and you're on a blood thinner and you hit your head, you can bleed to death. So there are some people, it's a really tricky question as to whether or not we treat you with a blood thinner or we say we're going to let you take your chance with a stroke, because a fall in somebody that's unstable like you that's going to you'll bleed to death
Fatal.
pretty quickly. Yeah, it's fatal. Yeah,
It's a fatal fall.
It's like I said, it's a really common problem, and we need to try to eliminate the risk factors as much as we can. Again, if somebody comes to a neurologist after having a stroke, which often we send them to, and they've got atrial fibrillation, they're immediately looking for sleep apnea, and often we detect that. So if somebody's telling you you're snoring or you're not breathing at night, don't blow it off and say I'm fine, because again, if you ignore that, 10, 15 years down the road, you could have a stroke, and that's a very difficult condition to live with, depending on how much neurological damage you have. So I see this. It's a very frequent. Again, 2 to 3% of the population has it, and you can live a long time with it if you control it. But we really want to try to prevent it, obviously, and reverse some of the risk factors for it.
Which would be pretty much the same as the heart disease because of things that you mentioned, obesity, etc.
Right. Tobacco use, alcohol intake, excessive alcohol intake can predispose you to that. So, and then obesity, and I mentioned sleep apnea, and then high blood pressure that's untreated. Some of these conditions like sleep apnea and hypertension, a lot of people don't know they have it. So, you'll see somebody that's 50, 60 years old come to the doctor for the first time, and we're detecting these issues, and they're like, I didn't even feel bad. Well, that's why you should be routinely checked to make sure there's nothing going on. It's just a real shame when somebody comes in and they think they feel pretty good, and you find out all these problems that have been going on for a while, and you don't want to wait that long. You want to be proactive and preventive.
Heredity does that have play a factor?
No, not necessarily. I mean, I guess heredity in terms of body type. If you tend to have obesity in the family, that can predispose you. If you tend to have people in the family that have sleep apnea, that means you may have a predisposition based on your anatomy of your neck and your mouth. So probably those are the only predisposing factors in a family line. But it's like I said, it's very common, and we really need to be preventive and catch it early. And sometimes we have to, if the rhythm is really out of control and we can't slow it down with medication, we do a cardioversion, which is we give you some sedation. We actually shock the heart like we would if we're trying to revive you. And sometimes that'll put the heart back in a normal rhythm. Sometimes it'll go back in a normal rhythm on medication, and people say, well, okay, I'm better now. Can I come off the blood thinners and the other treatments? And sometimes we can do that, but most of the time it's not safe, because often it'll flip back into that abnormal rhythm, and you don't know it until you're in the emergency room or until you've had a stroke. So there's a lot of resistance with a lot of people to take these blood thinners, and I totally understand why.
Yeah.
But there are really no good substitutes for the medications we use to prevent the clots other than those. I mean, people want to use natural supplements, and they've read and heard about other things that might work, and they really don't work. So if you go in and out of atrial fibrillation, sometimes an aspirin's all you need, but most of the time you need these other stronger ones that can cause more bruising and bleeding. It can be threatening in other situations. As
always, prevention is the best.
Prevention. Just see your provider every year, and just have a checkup and make sure that, let us review your history, your family history. Let's look at your blood pressure, some blood work, and make sure there's no subtle changes happening. That's our job, is to look at all these predisposing factors and screen you for hypertension and obesity and sleep apnea. Make sure that your alcohol intake isn't excessive. Try to help you stop smoking. I mean, those are the things that we need to do to be preventive.
And of course, you can't get a trend if somebody's not there more than once every 4 or 5 years.
No, it really is good to have that. I think everybody over 30 ought to have an annual routine blood screening test, just a typical health screening test that looks at these numbers. And then you should compare them from one year to the next, compare them really closely. And if you think there's a change or a problem, you definitely should see your provider. But take that into your provider's office every time you see them, at least annually, so that together you can review that.
Right. Hey, well, thanks. Next
welcome.
Next week, causes and cures for laryngitis.
We'll do that. Yeah.
Thank you.
I will whisper though.
Very good. Hey, the Talk with the Doc this morning with Dr. Tim McKnight, brought to you by Mako's Pharmacy,